Order.
Ladies and gentlemen, the opposition side is trying to act as if they are advocating for welfare. But ladies and gentlemen, that is not true. The proposition side is advocating for welfare. We talk about how it is a human right for everyone to have a healthcare, and that's why we advocate for a welfare. I cannot see how you have welfare when maybe you are a poor person and you suddenly have a strange cancer. A cancer that can only be cured in private hospitals. And then you cannot pay so. And you're almost sure that you're going to die because you cannot have that service, because you do not have that money, and you do not have a universal healthcare coverage. Ladies and gentlemen, that's not welfare. Knowing that you're going to die because of a disease that can be curable, but you cannot afford, that is not having welfare. Ladies and gentlemen, in the opposition side, I think it was Bernardo who said that you have the option to go to any hospital right now, even though you pay any amount of tax you have, even though you don't have the money to go to private hospitals, you have the I don't know who said so, but you have the option to go to a private or to a public hospital, but you have to work for it. Ladies and gentlemen, then you do not have the option to go for it. There are some cases where maybe you didn't study or you didn't have the opportunities, and so you cannot pay for such treatment. That is not being fair, and that is not having an option, ladies and gentlemen. No, thank you. I will go directly to some of the points that they said. They said that we cannot pay the cost to change the infrastructure, and they said that we cannot, that we have to raise the taxes, and we say that maybe we could reallocate the money of the government, so not necessarily you have to raise taxes. The GDP, we gave the example of France. In France, they only spend 10% of their GDP on healthcare. No, thank you, I'm explaining. While the United States, they spend 15% of their GDP on healthcare. So that 5% of extra money that any country with a single-payer healthcare system would have, that would be able to afford infrastructure change, because infrastructure change is not as expensive as the trade itself. Yes.
Then why does the Obama deal have such a huge cost behind it?
Good, because they do have to raise the money, and they're not in the best economical position. However, they are not reallocating the cost correctly. They're not taking into consideration that they would have even more money in the GDP, and they would have less. They would have to spend less money on these things. You said that we cannot, that they will not have, we're talking about a competition. They say that the hospitals will not have incentives, and we will have stagnation in the private hospitals. But ladies and gentlemen, that's not true. That's not really true. We really explained, and maybe the opposition side could not understand it, when we said that you would have competition because the government will pay the hospitals for the treatments that they give and for the services that they give. So the people would have the right and the freedom of choice to go to any hospital. And to what hospital would you want to go? To the best hospital in the nation. No, thank you. You want to go to the best hospital, and so the best hospital is the one with a greater quality of service. That's why there will be competition, because you will have to go to the one that has more quality and not to the one that is cheaper. That's why you would even profit, because you would profit by not reducing the cost, but by giving a higher service and so charging more. That is profit. And the opposition side is saying that they will not have profit. So that's clearly not totally true. They also talk about raising the taxes. They say that they should raise the taxes for rich, but ladies and gentlemen, how can you raise the tax for rich and then also be against raising the tax at all? That is a contradiction that they have. No, thank you. And they also said that rich countries should have better quality, and so it is related. But ladies and gentlemen, well, they gave the example of the United Kingdom, but ladies and gentlemen, the country with the greatest GDP in the world is the United States, and it is the 37th ranked by the World Health Organization. No, thank you. By Taiwan, when the Republic of China is in a better position than them, because they have a single-payer healthcare system, even though they do not have the same resources as the United States.
Yes, sir. No, actually, China has a socialized system of medicine, which your proposition is completely destroying.
Well, let me tell you that the Republic of China is not a People's Republic of China. I would recommend you to read an almanac. Now, going to the resource allocation, the rich people should pay for the poor. I will recall that what they are saying. They said that, well, they ladies and gentlemen, I said our team says we're not talking about a debate where we should have a socialist or a capitalist system. We should have a system that covers everyone. And here, no thank you. We would eliminate the rationing based on ability to pay. I will repeat what I said in the beginning. You can go to any hospital that you want, no matter the profit that you gain. And of course, that maybe even in the case that we would have to raise taxes, you will be able to go to any hospital that you want. And that is freedom of choice, and that is for being able to go to any hospital. And that is benefiting the poor people, not the rich people.
Without taxes, the government is not going to be able to provide good education and also good healthcare, and these will go down the sewage because you cannot make it.
I already talked about resource allocation, and I don't want to lose my time continue recalling so. Now I will go to recall some of our points we had. First of all, about our first point that was addressed by Regina were the economic benefits of a single pay healthcare system that in the system that is not universal, you have to pay double receiving one. You have to pay for insurance, and you have to pay the taxes, because you still have to pay the taxes for the public hospitals, for which maybe you will never go, and you will only receive either the cheap and bad public service, or to have to spend extra on private sector. And in this case, you only have to give one pay, the tax pay that you already give, and will receive the double benefit. You will receive the insurance that you have, and you will receive a life perk where you can be attended in the moment you want. And our second point was about increasing the quality of services. But ladies and gentlemen, this is one of our basic points, because we already talked about competition, how the hospitals would continue to have competition and would have even more profit, so they would give better quality of services, and they would compete for quality instead of price. And recalling the example of France, in France they have one doctor for every 430 people in the country. That is having quality. There you can attend everyone. They said that maybe somewhere in the United Kingdom you have to wait for 6 months for receiving a certain treatment, but here you can go to any hospital that you want, not for certain hospitals. Just for certain hospitals, and here we have more medics. In the case of France, where one could cover 430 of the population, which is quite a lot. And our other point about healthcare as basic need, well, we have to recall it because healthcare is a human right, as Antonio said, is Article 35 of the Universal Declaration of Human Rights, and it has to be for everyone. Healthcare is priceless, and healthcare is before anything. You cannot do anything that you want to do without health. You cannot even work. It even affects the economy. If you don't go to work, you will not have profit, and you will also not generate a service. That will also generate an economic loss. So in every aspect, not having a universal healthcare coverage, it does affect our country. And ladies and gentlemen, for the welfare and for the social responsibility of the service, instead of just a small portion of profit, is that we beg this House to propose the motion.